and give it a try. Greek food tastes really good. I've told you it's very, very fresh. It's very healthy as well. They don't put a lot of spices, which is very good. They don't even put a lot of salt as well. I didn't even taste any black pepper, to be honest. It was just a lot of olives and olive oil. So go and give it a try. Dusit, thank you so much for you who has been tweeting from 6 a.m. The hashtag is K24 Alfajiri. This hour, we're going to be discussing fertility. Why is it that more cases are now being reported of women and men having fertility issues, and what can be done? What causes it? That is what we're going to be diving into with my guest. Good morning, guys. Welcome to K24 Alfajiri. Thank you so much. New faces. We love seeing new faces. So let me start with you, sir. Kindly introduce yourself and what it is that you do.
Okay. I'm Dr. Kamau Kanyal. I'm a clinical psychologist, mental health professional, basically dealing with mental issues. I'm also a visiting lecturer at the University of Nairobi, and I'm also in private practice.
Okay.
Basically working very closely with Madare Hospital on matters of mental issues. Yeah.
All right, thank you so much for coming.
Thank you.
So my name is Cecilia Karanja, founder of Fertility Kenya. Yes.
And I'm Alfred Morage. I'm a fertility consultant based at Aga Khan University Hospital, Nairobi.
All right. Well, thank you so much for all of you for making it. Now, why did you start Fertility Kenya, Cecilia?
Fertility Kenya, I started Fertility Kenya because of a life experience. I struggled with infertility for 10 years. Yeah, I've been married, divorced twice. So I succeeded on my third marriage. So basically, during my struggle of fertility, I got to undergo so many problems. And after I succeeded, I decided nobody should ever struggle like I did. That's why I started Fertility Kenya, so that if you're struggling with the fertility, you can get somebody you can talk to. Basically, Fertility Kenya, we say, is a shoulder to lean on. So during my struggle, the first year was, the first marriage was crazy because we could not conceive. We stayed for around 3 years before we decided to go to the hospital. So when we went to the hospital, I was fine. The 4th year, that is when it was found that we had low sperm count in the family. So the partner then did not agree to that.
I didn't agree?
Yes.
To the results that the doctor gave?
Yes.
And said that it has to be your fault?
Yes. It had to be my fault, and he lived in denial. And it was so violent to a point that on the 6th year, we could not stay together. So I got into another relationship that ended up after 3 years because we could not get children. The society told them that Cecilia will never get children, yeah? But true to the fact that after that, I went to the hospital and I was told that I have blocked tubes, yeah? And I had fibroids. So
which you didn't have before?
Yes, which I didn't have before. Before I was okay. So in the second marriage, that is when I was diagnosed with blockage of tube and fibroids. Yeah. So Dr. told me that we have to operate, but it was very expensive, such that my partner then could not be, he could not cooperate. So he decided to leave me to get another person who was, I think, a little bit cheaper, who could just conceive like without using money. So that is how I ended up being so frustrated. I went under depression, and after 1 year of depression, I decided I can't continue like this. I went back to hospital. I tried to look for some money, and then I saved for the laparoscopy. That's when I was operated. After 2 years, that is when now I conceived on my own. Now, and then I got married on the third marriage.
What do you mean you conceived on your own?
I was with my husband, but I decided I ain't gonna get into marriage before I get a baby.
Oh, okay.
Because of the torture I had gone through.
Before?
Yes. So I decided to have a baby before getting married.
Wow. Yeah. Thank you for sharing your story. Yeah. Of course, we still have more questions that we're going to be asking throughout the hour. But, you know, I'm not even sure who I should ask. because I want to know what causes it and why men refuse the results when they come out. But I also want to understand what happens, you know, when a lady or even a gentleman comes and talks to you, Dr. Kamau, and tells you, my wife cannot bear children, or my husband has low sperm count, and it's tearing our family apart.
Yeah.
Where do you begin to counsel them?
Yeah. Okay, let me start by saying that infertility is one of the most devastating situations, specifically to a woman. As Cecilia has said, men will go into denial, but women come up. Women will talk it out. Women are more candid. But at the point of infertility, the first thing is statistics. Or this is out of experience and out of research. That infertility, many people go into depression, or many people go into psychological disturbances out of infertility more than any other illnesses, or more than any other illness. So that's where we start. When someone confesses that he or she cannot or has infertility issues, the first thing to know is this person is psychologically disturbed.
Yes.
That's the beginning point. At the same time, it's you need to have a lot of insights, because the person might not be knowing that he has that psychological problem. As Cecilia is saying, the former husband was violent. Basically, now when you speak of violence, that is one of the characteristics of a mentalistic person.
Yes.
Yeah. So infertility basically creates or brings in element of psychological disturbances or psychological instability. Also coupled up with many things, like in Africa, we don't speak about those. In Africa, we believe if a couple cannot conceive, the problem is a woman. You see. But I've been talking to men, and one-on-one, and what we do is basically in the world of psychiatry, the first thing is you ask the question, you know, why has it happened?
Yeah.
It's not the issue of you cannot, or you have infertility issue. The issue is, why is it there? So we look into many factors. Is it environmental? Is it genetical? Or because even mental instability itself can also be a cause of infertility, both to men and both to women. So our approach towards aspect of infertility, especially on aspect of mental health, is we first of all look at the mental wellness of the person, because the problem can be compounded further. If maybe the person has a history of mental illness, but is not aware, it could be in the family. So we have two aspects. I think Dr. Morage will give further into that. He's a gynecologist. Is that we have two categories of infertility. There's a primary infertility, whereby a woman basically cannot conceive, or a man for this matter. And then there is the secondary infertility, whereby maybe the lady cannot carry a pregnancy. So in most cases, we like when you're doing what you call mental diagnosis or mental analysis, we look at the person and realize if a person has a history of mental illness and he or she is not aware. Basically, let me use the case of a lady. If a lady comes from a history whereby the family has a history of mental illnesses, this person can conceive, yes, but she cannot carry the pregnancy. And if she does, many of them goes into what we call postpartum depression, which is basically a very severe mental illness. So that's where we start.
Oh, and people confuse baby blues with postpartum depression.
Yeah,
You're going through baby blues, but you think it's postpartum depression. Now, with so many things to factor in, let's start then with what actually causes infertility. And this is for both men and women. Yeah. And I know this is going to sound like a biology class for a few minutes, but you have to understand it from a medical perspective so that you can have, a clearer understanding of what exactly happens. The hashtag is K24 Alfajiri. Please join in on the conversation. Dr. Alfred, what causes infertility?
Yeah, we're going to try and make it simple.
Okay.
What I would say is a fairly common occurrence and occurs in about 1 in every 6 couples. So something we see very common in our clinics. We did a survey some years ago to find out, what causes fertility issues in our context. And the common things are blocked tubes. Like Cecilia was saying, she had, that is one of the issues. The next common thing is problems with sperms, the quality of sperms. And then beyond that, the other common thing is problems with ovulating, releasing an egg every month. Then, so those would be like the first three major causes. Then beyond that, there would be other causes which are not as common and possibly, would account for very few couples. Now, what we normally would insist is when a couple have lived together for about a year and they've not conceived and they've not been trying to avoid pregnancy, then that should raise concerns.
A year. When it reaches a year is when now you can go on.
Seek, and that's presuming that they are both in good health. They are young, less than 35 years of age for women, less than 40 for men. So if a year elapses, then they need to get checked to work out why they've not conceived. Now, we must always insist that they must come to the clinics as a couple, because there's been, an unbalanced feeling that it's a women's issue. It is not. And we always want to insist that men will account for about a third of the cases, and therefore they should come with their ladies to the clinics. And then after we do an initial evaluation, then we'd work out where do we direct our efforts to in terms of making a concrete diagnosis.
All right. And the men actually rarely come. But then again, as I was doing my research, it does say that it's more women than men who most of the times are the ones who have the problem. Is that true?
No, I wouldn't say that. If we look at data about fertility issues, and you want to categorize who is accounting for what, in about a third of cases, it's purely men. Another third would be something to do with the women, and the other third would be something combined between the couple. So we cannot say it's one or the other. It's likely to be contributory in equal measure for both the man and the woman. And that's why, women would come to our clinics quickly, in good time, but men would take time to come along. But would encourage men to always come with their women, because then the problem could be on their head, and sometimes it's easy things to sort, and then they achieve a pregnancy.
All right. Now, as Cecilia had mentioned, her first husband refused the results completely. Now, in that instance, what do you do?
Just to give an idea, what we do with men, it's very easy to assess men. All they need to do is, once we do a basic medical, evaluation, we ask them to give a sperm test. And then once we review that, then it will tell us immediately whether there's an issue or not. If we found some initial problems with the results, then we'd ask them to repeat that, just to be sure that the first one was not a false result. Once we confirm that there's actually an issue, then the next thing is to work out what do we do with them. So if you look at what we do to make diagnosis for women, especially, for example, to look at tubes, they go through much more. And if you compare that with what men need to do, it's very simple for men, and therefore they should not feel anxious if they come to the clinics for us to do an assessment.
All right. Now, should they share as a couple, maybe if they have that problem in their family where maybe it's not infertility per se, but you take time before you have, before you conceive? Should that be something that they share at the beginning of their relationship?
I would say that I might not be an expert in relationship issues, but I would say from a mental health point of view, is when two people come together, I think there's that candid, or there is that openness. I've seen situations whereby I've men friends, and I know them, and we've worked together. And don't tell me, no, Dr. Remy, I have a problem with my reproductive health. These are man telling. But now it becomes very, very, very difficult. For a man now, let me say this, for a woman, the emotional disturbance of, the emotional impact of the fact that she cannot conceive is higher than that of man. And to a man, the mental torture a man goes through when he realizes that maybe his system is not functional, his reproductive system is not functional, is also very, very traumatizing to a man. So in most cases, the first thing is, if such a situation arises, the best thing is to ask for help. Like Dr. Muraga is saying, even in a situation whereby somebody is denying an obvious problem, in the world of psychiatry, we say that is an indication of a mentally sick person. Denial of an obvious problem. So like Cecilia's husband is, I mean, the man went into total denial. So that is an indication. And you see now, the denial itself aggravates to grief and depression, which in case also accelerate the same problem.
Yes.
So as you continue denying, which to us is a mental issue, as you continue denying, okay, the problem is also aggravating. It is also accelerating. So the best thing is, in a relationship, if you respect one another and love one another, the best thing is to be open to one another. That's the beginning point.
Yes. Yeah.
Be open to one another. If you know you cannot conceive as a lady, just be open to your husband. If the husband has an issue with his system, let it be open. So that you don't, because of course you know what happens is that in such a situation, relationships will be strained. And of course you know there is, because the issue of conception, the issue of making a baby is an intimacy issue. It's a heart issue. It's a mental issue actually. Everything starts and ends in the mind. So the more relationships are strained, the more you tend to move away from one another. The more relationships are strained, actually, the more you get depressed and the brain cannot function as it's supposed to function.
Which is important, right? Okay.
So psychological wellness is very, very, very important.
So is it that we don't focus on our psychological well-balance?
I think to add on that, when you're getting into a marriage, in the African setup, you don't think like you're not going to get a baby. So you get into a marriage and thinking that you're going to get a baby. And the society think the first year you're going to get a baby. So when it doesn't happen, that is when you think, Lord, what is happening? You go to the hospital. But rarely do you find couples sitting down and discussing, like, we're going to stay for 1 year without conceiving, or we're going to stay for 2 years without conceiving.
Let's live our lives.
Let's
have some fun. Yeah.
Let's have some fun. Most of the time, you'll find that when people go for, they start living together or they do a wedding, the next thing they want a baby. So the issue of couples getting to discuss whether they want a baby or not doesn't come. In the African setup, I would say it doesn't come. So when it doesn't come, that is when you start realizing maybe there's a problem, and you start seeking for a solution. And that is why we're really encouraging people, before you get into a relationship, why don't you just get to know your fertility? Yeah, it's so easy. Yeah, like Dr. is saying, you just need to do, for ladies, you just need to do 3 tests: HSG, hormonal test, and the pelvic scan, just to check the normal things. And for the men, you just need to do the sperm analysis to just determine if you're okay or you're not, instead of you getting into a relationship and then struggling in it.
Oh, so you're supposed to get tested before?
No, not actually, if you allow me to interject there. Majority of couples will not have problems with conception. Like we said, 1 in 6. So that's about 85% have no problems at all. So we wouldn't ask people to get any tests done prior to trying to conceive and then failing to conceive, unless there was already an obvious problem. For example, if a woman didn't have periods at all, and then we need to be working out why are they not having periods. And if you're not having periods, then they are not releasing an egg every month. Yes. So that's already something which is apparent. Or, you know, some people would have genetic problems. That would mean that their reproductive organs did not develop, which is not common. Again, then that would be so apparent even before the time of reproduction comes in. Yeah. But for a typical couple who are young and healthy, the women are having, you know, regular periods. The men are healthy. They are not smoking. They are not using drugs. And there's no reason to suspect that they could have a problem. So what would encourage is let them get into a relationship. Let them try to conceive.
Fast.
But if they get to a year, then we need to check what's happening.
Okay, the same way now you've said after a year, Dr. is when you need to go back to the hospital and get checked. Is there a number of years in which you can now give up or throw in the towel? Does that happen? When after 10, 15 years you say, okay, you know what? I've accepted, let me now look into adoption or other options that I may have.
Now, after an evaluation and then a cause is found, then we want to address the cause that we found. You'll find causes sometimes which are very difficult to treat and very difficult to achieve a pregnancy, even with modern assisted conception treatments. And you can get to a point where you offer fertility treatment, doesn't work, and then those couples may look into adoption or look into living without a child. But the greatest majority of several trials of treatment will either conceive with treatment, and some will conceive even without treatment, like Cecilia.
Cecilia, you didn't seek any treatment?
I did laparoscopy, so I was operated.
What is that, Doctor? Explain to us who don't speak medical.
Now, what she's implying is her tubes were blocked, and then it needed surgical repair to try and open up and block the tubes, and then the tubes would be able to carry an egg and allow the sperms to come through.
All right. Now, you had been married thrice now, but how many years was that before you got a baby?
10 years.
10 years. Did you at any one point give up?
No, I didn't give up because at a point I wanted to know what infertility, what this infertility is all about. Why is it making me not stay into marriage? I really wanted to defeat this thing called infertility. So I came across the idea of IVF. So at a point I knew I'll get a baby. So whether it doesn't work for me, whether laparoscopy won't work for me, I knew at a point I will get a baby. So I never gave up. I never thought of adoption at a point. I have never thought about it. But
and how was it, your family? How are they reacting? Your friends? Did they stop talking to you? Your community? Did they say you are cast? As you know, in an African setup, that's what happens.
Let me say, you'll find a different reaction with different people. There are friends who will stand with you. There are people who will backbite you. Like as I told you in my relationship, there are people who came and told my partner then that you're staying with Cecilia and she will never conceive because they knew what I was going through there.
Cecilia, if you will allow me to interrupt you kindly because we have a caller, and then we'll get back to your point. Good morning, K24 Alfajiri. Hello.
I'm fine.
I'm
Shadida.
Okay.
I would like to ask the gynecological question.
Oh, go ahead.
To the expert.
Yes.
Yeah, I have been on depot for like 1 year. Then I stopped the depot. I think he understood what's the depot. It's an injection for family planning. So when I stopped, I missed my period. Then I was advised by another doctor to take M2 and Primolut N. After that, my periods were back, but they were not regular. They are coming after 32 days. But for the last 1 month, they came after 38 days. Then I went to gynecology. She prescribed me a Primolut N, 1 tablet TDS for 10 days. Then after my period comes, I should start the Overcare tablet 1. Will that help me? And I'm married for like 2 years. But I used the depot for 1 year, 4 injections.
Did you get her question?
I got, the first thing to say is depot, women who use depot once they stop, especially after using it for a long period of time.
You have to explain it for our viewers. Everything, you have to break it down.
So depot is an injection for contraception, for preventing pregnancy. It's given every 3 months. So if it's been used for several months and then it's been stopped, there can be a delay in returning of the periods. And that basically means that the lady is not ovulating, she's not releasing an egg. So what normally we do is we just reassure young couples that if they just came off depot, a period does not come the next month, there shouldn't be much to worry about. They can wait for another 2 or 3 months, and then periods will resume. If they don't resume or after about 3 to 6 months, then would do what we call a hormone test to work out, is there another issue why the periods are not resuming? And then that would tell us whether we need to be offering some form of treatment. So like what she's saying, some of the tablets she's taking are really vitamin tablets for pregnancy. And one of the other is a hormone tablet to bring on a period. But that doesn't tell us, whether the periods have not resumed because it was still an effect of depot or there's something else going on. So I would say to her, she's only 1 or 2 months. I don't think there's a real problem for her.
She needs to be a bit patient. Okay, fine. Now, with hormonal and non-hormonal contraceptives, the non-hormonal ones don't affect you much. It's the condom and the coil that people use. And then there's the hormonal, which are the injections, the tablets. Now, how long are they as well when you take them? How long do you wait until you can conceive? And I know it depends on someone, but how long would you give me an approximation?
Do you mean after stopping them?
Yes, after stopping them.
What would say is all hormonal contraceptives are reversible. So they're not going to cause any long-term effects in terms of future conception. Now, the pill, which is a tablet every day, as soon as the pill is stopped, the potential to conceive should come back immediately. The depot, as we just said, if the periods don't resume immediately, then there's a bit of a delay. The coil, which is the copper one, which doesn't have hormones, as soon as it's out, then conception can occur even the next month. Mm-hmm. There's a hormone coil as well called Mirena. Sometimes it would cause delay of return of periods as well, but generally speaking, these are all reversible things, and when they're stopped, then periods come back, and pregnancy can happen very quickly.
All right.
Yeah.
Okay, fine. Now, Cecilia had interrupted you. So let's go back to your point.
Where were we?
You were talking, I think, about your husband refusing the results, if I am not wrong, or maybe we've all forgotten the train of thought.
It can, I was saying...
Your family, yes, and your friends,
family.
yes, the ones who stood by you.
Yeah, there are people who will stand with you, and there are people who will deny, they will backbite you. So basically, you go through a situation whereby you don't fit in the society.
Yes.
Yeah, because you feel like everybody is talking about you. Yeah, even when you go to the other side, when you go to the other family, you find like everybody is looking at you like, what is happening? Why are you not conceiving? And to a point that they think that you're wasting time to their son. So basically, they feel like you're taking advantage of their son by not conceiving. Not knowing that deep inside you, you're really struggling, you're really doing something.
Yeah.
They think like you're not doing anything.
At all.
Yeah, but what I would want to tell our parents and our relatives is that we go through so much. The only thing we need from you is support. Okay. Yeah, we need you to support us, because if you don't support us, we're gonna crash. Because already, as Dr. Rikamau is saying, the psychological effect is so much. Yeah.
Okay.
There's another psychologist who said it's more than a mother and a patient. That is how bad it is.
Oh, wow.
Yes, because you don't know you're in it, but yes, you'll be depressed.
All right.
So when somebody else comes into that relationship and tries to put it down, then you're gone. You're not there.
Okay, let's take another caller. Good morning, K24 Alfajiri. Hello? Hello?
Hello?
Hi.
Hi.
What's your name?
My name is Fatuma Isaac.
Hi, Fatuma.
I have a problem. I have a hormonal imbalance.
Yes?
And don't have periods for like 5 months, and I'm scared of having like the fertility problem.
Oh, high airtime. All right, do call us back. The number is at the bottom of the screen if you have any questions. Today we talk about infertility in studio. We have a lot of questions that we still need answers. Options of treatment being one of them, Dr. Murage.
Right.
Oh, Alfred, sorry.
There are many options for treatment, and it will depend on what the issue is. At its most basic, if we have a simple problem like failure to ovulate, to release an egg every month, then what we need is to give some medication, usually taken by mouth, that will, initiate ovulation regularly, and there'll be conception within 3 to 6 months. If we find there are issues with sperms, then what we normally would work out is this something minor that can mean, simple treatment, and then that's going to correct the problem, or is it something major? So a few mild problems with sperms would require something we call insemination, where we give the women some medication to release more than one egg, and then when the eggs are ready, then we bring them in to give us a sample of sperms. If you have more complex problems, for example, very severe problems with the man, or tubes are completely blocked, they cannot be repaired, then the way out is IVF, which is a complex process, which is quite expensive. A small category of women with blocked tubes may benefit from surgery, like Cecilia, and then they would conceive after that has been done. So every couple will have their own directed treatment depending on what the problem has been identified. Yeah, yeah,
All right.
yeah.
Are you done?
No, I was going to say,
going on. Okay, no problem.
Cecilia, something I forgot to say when Cecilia was
Yes.
talking about tests. Couples who know that they're going to delay having a pregnancy, but they want to have a pregnancy in the future, for women, there's some tests that can be done to predict what is the potential of their ovaries beyond a certain age.
Oh, really?
Yes.
Okay.
For example, we talk about age 35 as a critical age when ovarian function starts to decline. So couples who know they're going to delay their pregnancies beyond the mid-30s, then they can do a simple blood test, and that will tell us at that point what is their ovarian potential. And if the ovarian potential appears to be so declined at that point, then sometimes you can do what is called fertility preservation. Equally, men can do that as well, usually, as a check for their sperms. But we're talking of people in advanced age who are delaying pregnancy.
Yeah. Now, back in the day, couples tried to conceive when they were much younger. But in today's world, because of our careers and because, of the high cost of living, you end up, pushing that to much later. And now everyone trying to build an empire. You try to maybe around 30, early 30s for women, late 30s and early 40s for men. Is there a perfect age in which you need to start conceiving?
Yeah.
Okay.
We would say, if looking at, reproductive potential and decline with age, would say below 35 is the best time. From 35 onwards, there's a steep decline in potential to conceive year after year. And by the time people are in the 40s, the potential to conceive comes to about, below 10%. Yeah.
All right, fair.
So I think if couples are out there, there's competition with their careers, with whatever else they're doing in their lives, then they're also planning pregnancy in the future, then the earlier, the better.
Yeah.
Yeah,
All right,
yeah,
fine.
yeah.
Okay. Now, Dr. Kamau, if we talk about the psychological impact of infertility, whether it's to men or women, is it that they want to have, sometimes, the stress comes from other people, where now they bring it to you and they tell you, oh, I'm sorry, we have a caller. Good morning, K24 Alfajiri, hello? Hello?
Hello.
Hi.
Hi.
Fatuma, is it you?
Sorry?
What's your name? I thought you were the other caller. What is your name?
No. My name is Anne. I've just called. I'm with, yeah.
Okay, no problem. So kindly tell us your question or your comment, please.
What I'm asking is,
Yes.
I had fibroids, and they were removed the first time. The first time they were removed, I was told that one of my tubes got blocked. Then they came back again, so I removed the second time. So the right one also was blocked. So then I was told to go and reopen my tube. When it was done, now I started trying to conceive, but I never conceived. Then the next time I went to see the doctor, I was told that I don't have eggs. So I was put on some medicine.
Yes.
She said they were for ovaries, but I never conceived. So come last year, I started the hot flashes. So when I went back there to the hospital, I was told I'm on menopause. So I was given
How old are you?
menopause.
How old are you,
Menopause
if I may ask?
At the moment, I'm 42 now.
You're 42.
Yeah.
And how long have you been trying to conceive?
For the last 7 years.
Dr. Ari?
Yeah. The first thing to say is fibroids are very common, and majority of women with fibroids don't need them to be removed. And we need to be very careful before we say the cause of failure to conceive is fibroids. So before we say that, then we want to be sure that there's nothing else the matter. So that's important.
Yeah.
Then any surgery that is done in the pelvis can affect the way the tubes work. So it's possible that, after she had her surgery for the fibroids, then during the healing process, then one of the tubes was affected by that. And then she had subsequent surgery again, and then possibly, that interfered with the other tube. So when you get to that point where now both tubes are completely blocked, you cannot salvage them, then the way out for her would be, IVF. Now, in terms of declining ovarian potential, she says she's 42. We see a decline in ovarian potential, from the late 30s onwards, and some people genetically would be predetermined to have a decline which is faster than other people. So it's possible that, she's, yes, 42, but she's at a point where she has very declined ovarian potential. That's why she has very low number of eggs in her ovaries, and that's also reflecting in her getting hot flashes, which is a reflection of low hormones.
Yeah. Okay. All right, fine. Now, Dr. Kamau, oh yes, you wanted to add something?
Just to add on what Dr. Baraga is saying, in terms of medication, infertility medication, if not properly taken into consideration, it can also trigger other issues. Because this is a woman who is going through some psychological problem. Now, we are trying to correct a certain problem, but in the process, we create another problem. So we can create a problem within a problem, meaning if infertility drugs, infertility medication is not taken cautiously, it can also create another problem now either to the woman or specifically to the lady.
A problem that wasn't even there before.
That was not there, because this is a person who knows, for example, if it is already, I have this problem. Now, if there was no proper external or internal support to help this person go through the process, that's what I'm saying, medication should go alongside what we call psychotherapy. So that this person can have psychological wellness as he or she tries, or as the person as she tries to correct the problem of infertility. So psychological input is very, very important at that particular point of a process of medication.
To add on that, I would also want to add on that because...
briefly, please. We're out of time.
Yes. I want to add on that because at times you go to the hospital and find the only person we have is the doctor.
Okay.
And sorry to say, they take a lot of our time.
The doctors?
Yes, the doctors. Sorry, Baraga, for this. Because like this lady has stayed for 7 years without conceiving, whereas she would have been hijacked at that point when she went to the hospital. When they realized that she's having the fibroids, they would have said, let's do an IVF, which will be a solution. Or let us, because you're heading to menopause, let us preserve your eggs.
All right, they should have given her options.
They would have given her option instead of them doing the surgery and then wasting the time for 7 good years.
And
now
she
they're
was
telling
30,
her,
and now she's 42.
And now she's 42. Now she will never use her eggs. So she will either use a donor egg or never get a baby, do adoption. So I would also urge the doctors, when you're dealing with such cases, when they come to you, give them a solution.
Give them a solution and options. All right, fine. Now, how about food as a solution? There are foods that you can eat that would boost your fertility. Let's take a look at this.
If you are trying to conceive, stop drinking skim milk as it has been found to promote infertility. Instead, opt for whole milk, which contains a good amount of calcium that is great for reproductive health as well as your bones. Avocado. This fruit boosts fertility due to its high content of folic acid, monounsaturated fat and good enzymes. Folic acid, a type of B vitamin, helps boost fertility in both women and men, and it also helps prevent neural tube defects in babies. Olive oil. The monounsaturated fat present in olive oil helps improve the body's sensitivity to insulin and reduce inflammation. Both of these are good for fertility. Oysters are an excellent source of zinc, a highly essential nutrient for those who are trying to conceive. In males, zinc helps increase testosterone and semen levels. Zinc deficiency in the body has been found to disrupt normal menstrual cycles in women and slow down the production of good quality sperm in men. Broccoli can help boost fertility. In men, vitamin C improves sperm quality and protects sperm from DNA damage. In women, it helps reduce the chance of miscarriage and chromosomal problems. Eggs. Eggs contain vitamin D, which plays a key role in boosting fertility. According to a study done by Yale University, infertile women often suffer from vitamin D deficiency. In addition, eggs are rich in antioxidants and proteids that boost fertility in women. Black beans are rich in fiber that helps regulate blood sugar levels, which helps reduce fertility issues such as polycystic ovary syndrome and immunological issues while promoting a healthy hormonal balance. Salmon. salmon is one of the best fertility-boosting foods. This is mainly due to its high content of omega-3 fatty acids, which can help regulate reproductive hormones, increase blood flow to reproductive organs, and even minimize stress.
Why does time fly by so fast? I don't understand. All right, so now Dr. Kamau, closing comments.
Yeah, I would say that, I would say that one, infertility, because it's a psychological problem. So any person who is going through that phase should seek both medical and mental help.
Do you have patients at Mathare that, you know, got there because of fertility issues?
Yeah, we have, actually, I'm saying if this person, if proper care is not taken, the person starts with stress. It's more stress, more depression.
So
now depression now graduates to the next level, which you call mania, which in the layman language you call madness. As we don't have that language, we call it psychosis. Now at that particular time when psychosis strikes you,
it's a bit late.
It's a
bit late.
In most cases, it is irreversible.
All right.
So any person going through that, seek both medical and mental help.
All right, fine. Cecilia.
One second. What I would like to say and what I want to tell everyone is that there is a solution. You just need to come out of your situation, come and look for Cecilia, or go and look for help from a gynecologist. Once you come to us, we give you options. We tell you there is this that you need to do.
All right.
Because what you just need is to know that there is a solution. You don't need to be depressed.
Okay, fine.
Yes.
Yeah, to get to now psychosis, as Dr. Kamal was saying. All right, fine. So there are options of freezing eggs for those, you know, ladies who want to put their career first and wait until, you know, when they're 40 or 35. You freeze your eggs. How much is it to freeze your eggs?
They would need to go through IVF. It will cost about $500,000.
IVF is $500,000?
Yeah, roughly $500,000, yes.
And the storage of the eggs, does that cost you money?
Yeah, that in most clinics will store the eggs for 5 years.
For 5 years?
Yeah.
How much is it?
Yeah. So they, you know...
Is it a separate fee to store the eggs?
No. That fee, which includes the IVF treatment and storage, you know, for 5 years, you know, would be about $500,000.
All right, fine. Yeah. Wow. Yeah. So how long is the process of, you know, taking the egg?
Basically, because women will need to go through what we call stimulation and monitoring until the eggs are ready, then the eggs are removed. It takes about, 2 weeks.
And you can do the same for men? And
baby. It's very easy to store for men as well.
Yeah, and it's the same price, $500,000?
No, because men just need to give a sample to be stored. They don't need to go through all this stimulation and monitoring and all that.
How much is that?
It's about $20,000.
About $20,000?
Yeah.
That is
So
a huge
I was going to say what Cecilia was mentioning.
Dr. we're out of time. I'm sorry. Okay. I'm so sorry. But my director is telling me that we need to move. Sadly, we're out of time. There's so many options, though, for those who cannot at all, conceive. You can look at having why has the word disappeared from my head? When you have another lady to carry your child.
Surrogacy.
Yes, surrogate. Why did it disappear from my head? All right, so there's surrogacy, there's, adoption. There's so many other options you can look into, but try and find a solution. As Cecilia said, we're out of time. My name is Amina Abdurabai, and did you learn something?
Certainly, indeed. Unfortunately, we cannot talk more about it, but just in case you did not get this, you can always catch it on our YouTube page, that is at K24 TV, and of course, you can actually further search for K24 Alfajiri, and you shall get this discussion right there. Let's do this again, same time, same place tomorrow. The time is always 6 to 9 a.m. Thank you very much for those who've been tweeting and those who've been talking to us. Let's do this again tomorrow. My name is Ian Ofula. Have a lovely day.